Itasca County is hosting press briefings to highlight themes emerging in our community related to COVID-19 or frequently asked questions posed by our community members. We are providing weekly written updates for the media through the month of July. We are discussing masking today. We recognize that masking has been a hot topic and a topic of debate within our community. And this is a topic being discussed related to businesses, schools, childcares, bars, restaurants, and other public spaces. There are questions on how masking prevents spread of a virus. Is wearing a mask safe? Will a teacher wearing a mask be able to communicate effectively to a child while wearing a mask? These are all ongoing topics of discussion and some that we will address today. We are highlighting business owners who are asking their employees to wear masks. When we discuss businesses and masking, we do receive comments and complaints when there is lack of adherence to the governor's executive orders related to masking. There are community members who are making choices about giving their business to establishments regarding whether or not they're adhering to the governor's orders. And we want business owners in our community to be aware that these are discussions that are happening locally. And we have learned that as early as next week, more guidance on adherence to governor's orders will be forthcoming from the governor's office. And we will discuss masking more with our panelists, who are Dr. Dan Suler, Vice President of Medical Affairs and Family Medicine Physician, Grand Itasca Clinic and Hospital; Nathan Lane, Store Manager of Super One South in Grand Rapids; John Ryla, President, Ryla Companies of Big Fork and Deer River, home of Minnesota Timber and Millwork branded products; and Allie McInerney, Communications Associate, Blandin Foundation, and volunteer from Mask Up Itasca Project. Before we get to our speakers, I will provide a situational update on COVID-19 in Itasca County. As of today, we have 68 Itasca County residents who have tested positive to COVID-19, and we remain at 12 deaths. The case age ranges are from 6 to 94. We know there are cases on our list that have ties to other counties and communities, and even other states. And we know we have at least 5 positives that were tested and were visiting in our county that reside elsewhere. We encourage our community members and those that visit our community to continue to be safe, practice social distancing from persons outside your household, wear a mask in public spaces, wash your hands with soap and water frequently, cover your cough and sneezes, and stay home when you are ill. And we thank you for all you're doing to slow the spread of COVID-19. I will now introduce Dr. Dan Suler, Vice President of Medical Affairs and Family Medicine Physician, Grand Itasca Clinic and Hospital.
Good morning, Kelly. Thanks for having me along this morning. So I just wanted to touch a bit about some misconceptions and some controversies surrounding wearing masks. We know that wearing masks help reduce the spread of coronavirus from an infected person to those surrounding that infected person. Estimates would say if we all wore masks when we were out in public, we would likely reduce the transmission by 50%. I can tell you in medicine, there's not a lot I do on a day-to-day basis that I can tell my patients that I can reduce your chances by 50%. So that's a huge way we can reduce our risk of transmitting the virus. Living in northern Minnesota, hockey is a big part of our culture. And so a lot of my patients, the way I've tried to explain to them is, the hockey net at the end of the rink allows snow to go on the rink and off the rink. And that's really our oxygen and carbon dioxide. And so when we're wearing masks, gas can pass very freely from one side of the mask to the other. However, if you're sitting behind the boards and somebody shoots a slap shot, you sure hope there's a net there. And that slap shot is, what I would think of as respiratory droplets with the COVID virus on it. And so, the way masks work is they allow the gas to exchange from your lungs to the environment and vice versa. But it'll catch any virus that you may be transmitting into that mask, thus protecting those around you. We get a lot of questions as far as if I have respiratory disease, how does wearing a mask affect that? And again, there's been many studies on this, a lot most recently, and there has not been one single study that says your oxygen levels decrease or your carbon dioxide levels increase by wearing a mask. So, we're just really trying to push that and make sure people get accurate information. because that's important reason to wear that mask. And then finally, I just want to touch a little bit on clinical experience wearing masks. 3 months ago, we were not wearing masks in the clinic, but we certainly do that now from the moment we walk in the doors to the moment we go home. And it is something to get used to. We definitely need to acknowledge that it's inconvenient, but we know it saves people from getting infected and potentially saving lives. Our folks, our employees in the operating room have worn masks all of their careers. We have surgeons and nurses and anesthesia personnel that wear masks for 8 hours a day without taking it off, and they're not dropping down from a lack of oxygen or getting lightheaded because of too much carbon dioxide. And so we have a lot of experience wearing masks and can definitely reassure the public that wearing masks is safe, it's healthy, it's inconvenient, but you'll get through it. We've done tougher things. Thanks, Kelly.
Thank you, Dr. Suler. I will now introduce Nathan Lane, Store Manager, Super One South, Grand Rapids.
Good morning. Can everybody hear me?
We can hear you. We can't see you.
Okay. Well, I don't know how to fix that. This is my first Zoom meeting, so I apologize for that. But they just asked me to come on and say a little bit about our business and the masking and other safety precautions that we've taken since this COVID-19 hit. We've been a part of the grocery businesses, but owned by miners, has been part of Grand Rapids since 1943. So we care about our customers, we care about our employees. I have a son and a daughter that both work in the store, and so this has become a big issue. And it's nice to work for a company that, starting April 11th, it became mandatory that all employees wore some sort of mask, a face covering, a bandana. Company supplied face shields, and that's been ongoing now since then, so 3.5 months. We just got a release from HR yesterday saying this is going to continue as long as it's recommended by the CDC. This is what we're going to do. It was nice to hear from the doctor. I have many employees talk about feedback. A lot of employees don't want to wear the masks. A lot of vendors don't want to wear the masks. And this is a good part of educating them on the benefits of what wearing a mask is, and can decrease your chance of 50% of getting COVID. I think it's worth doing. I just listened to some Major League Baseball radio last night, and their biggest player, Mike Trout, Major League Baseball has now made a shirt and is marketing it, "Be Like Mike," and it's a picture of Mike Trout wearing a mask. So I think education is a lot of it. Other steps the grocery store have taken, we sanitize our carts every single night with bleach and have employees stationed at both entrances sanitizing them from the hours of 10 to 6, and then have sanitizing wipes available. In between those times, we have hand sanitizing stations. We've got the acrylic dividers at the cash registers. To this point, the last I heard now, Super One has nearly 3,000 employees throughout our 40 businesses, grocery stores and liquor stores. And the last I've heard, we had one confirmed case since this has started. So anyway, thank you. That's the information I've got.
Thank you, Nathan. And I will now introduce John Ryla, President, Ryla Companies of Big Fork and Deer River, home of Minnesota Timber and Millwork branded products.
Thanks, Kelly. Can you hear me okay?
I can hear you. Thanks.
Super. Yeah, I'm really pleased to be here. I appreciated what Nathan just said, and it struck me that the Ryla family has been operating sawmills in Itasca County since the early 1940s, so about the same time frame, and it's a great way to look at it. We care about our employees and our customers both. Well, I was really concerned when the governor first started to take action wisely to protect all of Minnesotans, and I honestly didn't know if our business was going to be considered essential or what the rules were going to be. That jolt and do we do if we can't operate, was enough to motivate me that when we were considered essential, and we don't take it lightly how fortunate we were, but I agree that I think that we're providing some essential products and services. I immediately took more seriously actions that give us the opportunity to continue to operate, and we've had some those actions were cleaning of equipment, providing safety supplies to our employees, certainly including face coverings. I tend to use the term face coverings. I know that's probably a small or a minor detail, but I think mask kind of has a negative connotation, so if I say face covering, you know what I mean. We have since upped our game as things have progressed. We had within our employee group, one of our employees, no doubt, had an undiagnosed infection with the disease and was connected to one of the unfortunate outbreaks in Itasca County. That scared us, and so through all of this, we've had employees scared. We've had employees refuse to come to work. I've worked closely with them to make it non-confrontational, to enable them to get the benefits, their federal and state benefits. But all through this, we've been able to keep up our service level. And our present situation is this. I'm advocating for 100% use of masks by our employees and our customers. I'm having some pushback from employees, but that's easy for me to fix in obvious ways. But I do allow the employees, when they're more than 6 feet apart, to take a break from the mask, because it's tough work what we do, and they got to be able to let their mask down when it's practical for them to do so. A bigger challenge to us is our customers. We have two major customer groups: local folks, whom we love and appreciate, and our metro, especially Twin Cities folks. Just checking in, Kelly, can you still hear me? Great.
Yes.
Okay. I'll just be really blunt. Our local folks tend to be Republican, pretty conservative, or consider themselves conservatives. I consider myself a conservative. I'm not so sure about the Republican part anymore, but that's a different issue. But it's driven by what's going on right now, both locally and nationally. So I'll just go ahead and say it. So our local customers are a very conservative type. We love them. We appreciate them. They're the doer type of people who buy our products because they get things done, but they don't like wearing masks, and they don't like, and it's a political thing to some degree for them. And that's really unfortunate, because that's driven by our president, and very disappointing to me. Interestingly, our customers from the Twin Cities, I think, are much more practical, follow science. I believe that they probably practice facial protection in their metro communities, but when they come out into our area, the rural areas, it's less so. So for those reasons, I've just recently, and with the help of you folks of Mask Up Itasca, with the encouragement and with the supplies, we are now going to require full-time masking with our face protection of our guests, along with our employees. And I'm going to be the bad guy. Our employees don't like to enforce it because it's an uncomfortable thing, but I can be the bad guy. So anyway, we're completely on board, and hopefully this is one way we can help lead in this community, because this is really important for us to keep up. If we don't, we may not be able to operate our businesses, and like a lot of small businesses, we can't afford to not operate for very long.
Thank you, John. And I'll now introduce Ellie McInerney, Communications Associate, Blenheim Foundation, and volunteer Mask Up Itasca Project.
Thanks, Kelly, and good morning, everyone. As Kelly said, I'm here this morning on behalf of Mask Up Itasca, which is a group of community partners who came together about a month ago with the goal of finding ways to show appreciation for those who are wearing masks and who are promoting wearing masks in the Itasca County area. As we heard this morning, the science and guidance from the medical community is clear. Masking helps stop the spread of COVID. And our group wants to thank those who are doing their part while also encouraging others to follow suit. We know through social science research that recognizing and lifting up positive actions like those who do wear masks to help keep their community and neighbors safe will help others who might be on the fence make the same decision. So we're reinforcing those positive stories and working on projects that will hopefully normalize the choice to wear a mask. In businesses, out in community, with friends even. So we're excited to see that partners across the county, like ones that we've heard from today, are stepping up to spread the message of Mask Up Itasca. We have a couple projects rolling right now. First is one that's led by Grand Itasca. It's an effort to offer businesses Itasca Strong mask stations and signage at their locations. And we're seeing great success with this. 16 businesses are participating so far, and they're generating some cool stories and social media content when they get those stations. For example, just a few days ago, Nashwauk Market posted about their mask station and took a selfie with one of the employees or owner, I'm not sure, who was sporting one of the Itasca Strong masks. So that was fun to see. Of the 16, the Judy Garland Museum, Grand Rapids Gun Club, and Minuteman Press are just a few of the places that have opted to have masks available for the public. So that's one project that's rolling and really getting some good traction in the local area. Another project that we just kicked off is a Masky challenge for teens. As our group was talking about where we're seeing masks show up in the community, we were inspired by local teens who are wearing them during their summer jobs at restaurants, grocery stores, hardware stores, and more. And so to appreciate what they're doing to keep our community safe and encourage them to wear masks outside of work, we're challenging them to take a selfie, or what we're calling a masky, tag their employer, share it on social media, and that will earn them a chance at a prize drawing on August 3rd. So we're just kind of getting that out with the help of some local school districts and activity groups to connect to teens. So we're excited to see that kind of take off. So those are just a couple of the projects that are rolling right now. We've got a motivated group of partners, and we're following kind of the energy of the community. So it's fun to hear this morning the different businesses that are doing work that aligns with what we're trying to do, to appreciate those who are taking these actions. And we're encouraged by the feedback and look forward to finding new ways to do this in Itasca County. So thanks, Kelly.
Thank you. And we will move into the question and answer portion of our press briefing. We do have local and regional media with us. We ask that you submit questions via the chat with your name and the media organization that you represent, and our panel will respond. We also have Jean McDonald, President and CEO of Grand Itasca, joining us for the question and answer. And we have a question. After the news release, some viewers were concerned about people, this is Beth from ICTV, we're concerned about people who tested positive that were visiting the area. Those numbers don't show up in the local census. Is there any indication of the number of people visiting who tested positive while here? They are concerned with positive contacts with sick visitors. Great question. One that is a little more difficult to track because we do not receive those numbers within our line list that we receive from the Minnesota Department of Health. We know of at least 6 that were visiting the area tested positive. They will return to their community and have contact tracing by either Minnesota Department of Health or the local public health agency, who will help them determine who their close personal contacts were, which are people within 6 feet of each other for longer than 15 minutes. And then those contacts would be reached out to as well, either by the person who tested positive or by the health organization, and will provide education, give them precautions on keeping other people safe, and how to, or how and when to receive testing if needed. We do want to let everyone know that community spread is the #1 way that spreading is occurring now in Minnesota. We're not immune to that up in Itasca County and our surrounding counties. Community spread is happening when we're not masking and social distancing, and so we want everyone to keep with the safety measures, and masking is one of those, and the social distancing. Next question, Beth from ICTV. Servers in local restaurants are wearing masks, but how do we kindly encourage them to keep their mask on correctly? A lot of them let their noses poke out or are always adjusting their mask while serving. Dr. Suler, do you want to take that one?
Yeah, sure. I think, with anything, I would, as a person visiting those establishments, I would not feel uncomfortable asking them to put the mask back on correctly. Correct placement of the mask, of course, includes the nose down past the mouth over the chin. I acknowledge it myself when I'm wearing my mask all day long. I'm touching it, readjusting it. It is difficult. We can't pretend it's easy. But I think all of us just giving gentle reminders to those that are around us is in the best interest of our community.
Thanks. And the next question is from Jennifer from ICTV, and this is for Dr. Suler. My question would be, is it all or nothing? With the rules for using a mask, it seems some people are thinking, well, if I need to do all that, I might as well not bother. Is it more important to wear a mask even though you may not be following the directions perfectly?
Yeah, even wearing a mask perfectly is not 100% effective. At best, it's about 50% effective, which is better than 0%. And so, if we can wear a mask all day long, that's great. If it's 3/4 of the day, again, that's better than nothing. So I tell people, try to do as best you can for as long as you can. And it's one way to get through this pandemic.
I don't know.
Thanks. And Alejandra from WDIO, is there a mask ordinance being considered for Itasca County? And the answer to that is no, not at this time. We have not discussed that locally. Kathy Lynn from KOZY, there are still some groups making homemade masks. Is there a place to donate them? And I'm going to answer that quick. Elder Circle, yes, is taking masks and distributing them to the community. And I do believe our local clinics and hospitals are taking them as well.
Oh, yeah.
And what is the difference between the paper and cloth masks, N95 being the gold standard? Dr. Stuhler, do you want to?
Sure, I can sure take that. So all masks help protect me, help protect the people around me. Not every mask protects me from people around me. So it's a little confusing. So again, the homemade cloth masks will protect me from spreading it to folks that are sitting around me. The paper masks or surgical masks that we use in the clinic help both the wearer and the person around the wearer. N95s, what that means is it's designed to protect from 95% of particulates passing through the mask. So it's a higher level of protection. And again, in the hospital setting, we're using those types of masks in patients we know have COVID or potentially have COVID. So it's all about increasing protection. All masks protect me from spreading it to anybody else.
Thanks. We're down to 7 minutes. Do we have other questions from the media? Okay, seeing none. Thank you all for joining us and for staying safe. Have a good day.